Good morning and welcome to you all. My name is Ulysses Burley. I am the founder of UBB Care LLC, and I will serve as one of the presenters for today's panel discussion uh, on this Faith Day, the first day of the 11th International Conference on Stigma. Before I begin, I would like to introduce Dr. Sahil Radha, who will speak more to this week's events and give you background for which we are gathered here virtually. Dr. Rana is a board certified pediatrician at Howard University in Washington, D.C., where he, for the last 35 years, has cared for children living with HIV. In doing so, he has not only been their physician, but he has also become a father figure to many of them as they have traversed life with the challenges of living with HIV, those challenges much so grounded in stigma. And so from his own observation of the ways in which stigma negatively impacts people living with HIV, but even more specifically, young people living with HIV, Dr. Rana and his colleagues founded this International Conference on Stigma to address these social determinants of health that go on to impact our physical health and to make us sick. And so at this time, I'd like to welcome Dr. Rana to speak more to the International Conference on Stigma, to welcome you all and to give us our directions for the week. Dr. Rana, you have the floor.
Assalamu alaikum warahmatullah. Good morning, everybody. Such a pleasure, and I'm so grateful and thankful to be part of this program this morning. I'm in Washington, D.C. I work at Howard University, and I've been at Howard for 40 years. Thank God for that. All praise belongs to God. I started taking care of people with HIV about 35 years ago, and many of them were young children, newborns, and many or most of them have grown up with me here in Washington, D.C. Most lost their parents to HIV/AIDS, and they call me dad. And as they grew up, I started hearing from them the pain, the stigma of HIV and related situations that were really killing them. It was affecting every facet of their life. They could not go to school. They could not have a relationship. They could not even eat dinner with their families. And I recall one of my children who was 19 years of age, and I would call her Chelsea. Around 14 years of age, she stopped taking her medication, and I could not convince her to take her medication. And one day I sat down with her and I said, Chelsea, what's wrong? And she said, Dr. Anna, even my closest friends, my cousin who was my buddy all my life, and she was the only one I could tell everything to. And last time I got the courage to tell her that I have HIV, and she said, oh, and then she moved away. And she said, that broke my heart. And from that day on, I haven't taken my medication. So Chelsea stopped taking her medications that could have saved her life and given her a normal life. And she died. She died at age of 19 years of age. And she could have lived a normal life taking medication. But unfortunately, it was the stigma of HIV that killed her. As we started our first conference in 2010, many people have been extremely helpful. Many of you who are here, including Mike, Ulysses, you have participated, and Khadijah has been our partner. So I'm extremely grateful to all of you for being a partner and leader for us. in continuing this effort. It would not be possible without your help. Like God said, and like somebody said, that we are only an angels with one wing, and without embracing each other, there's no way we can fly. And your partnership is so meaningful, your leadership is so meaningful, and you're having day one session on faith is so meaningful. So I praise, all praise belongs to God. Allah subhanahu wa ta'ala says in Quran, La in shakartum la azidannakum, that surely I'll certainly give you more if you are grateful. So I look forward to this effort really catching fire. We are where we are able to make difference in all mosques, in all churches, in all synagogues, in all places of worship, to stop stigma from killing people with HIV and stop stigma from affecting other illnesses and preventing access to care. And I look forward to learning a lot from all of you today. Ulysses, Khadijah, Mike, thank you so much.
We are indeed grateful to God, and we are grateful to God for your leadership, Dr. Rana. Thank you for that warm welcome, and we look forward to the days to come from what we learn from each other about stigma in this very difficult time. At this time, I'd like to welcome my co-presenter, Khadijah Abdullah, to offer words of introduction for herself before we begin. Khadijah.
Thank you, Ulysses. Thank you, Dr. Rana. Thank you, Dr. Burley. Good morning, good afternoon, good evening, wherever you are in the world. Thank you for joining us today on this beautiful Monday here in DC area. I'm really honored to be part of this panel. Dr. Rana has been doing this, as you mentioned, for years, and I just joined maybe within the last 5 years. And mashallah, all praise to God, I've seen how this conference has grown. Looking right now, I see 105 people online right now. Wow, you guys are up early. So I look forward to a robust conversation. My name is Khadijah. I'm based here in the DC area. I'm the founder of Rahma, which means mercy in Arabic. And I'll talk more about that later on in my presentation. And I look forward to hearing from Dr. Rana, Dr. Burley, and hopefully from you all as well. If you have questions or comments, please put them in the Q&A or chat area, and we can hopefully respond to them. So thank you. Let's get started.
All right, let's get started. This time I'm going to share my screen. All right. So again, my name is Dr. Ulysses Burley. I am the founder of UBD Cure LLC, which is an organization that operates at the intersection of faith, health, and human rights with a mandate to end the HIV and AIDS pandemic as a public health crisis. I am an allergist and immunologist by primary training, but I have chosen to do this work in this way because it meets all of my needs in terms of my clinical training, but also my very deep spiritual and faith background. And so I founded UBD Cure from my own experience as a healthcare provider, realizing that we could not meet the full health needs of people in hospitals alone, and that there needed to be more attention given to the social drivers of disease to achieve a more complete wellness for society. As I mentioned, as a person of deep faith, my pursuit of that complete wellness, not only for society, but for myself, has largely been informed by the very prominent themes of healing and sanctity of life in Scripture. It's with this understanding that I, along with Khadijah, present to you Faith in Resilience and Renewal, Healing the Divide, where we'll explore the role of faith communities in addressing HIV and COVID-19, including the vital work of reducing and eliminating stigma. So sickness has plagued us since the beginning of time. It's the reason why healing is such a key component of our sacred text. There has always been more than enough sickness to go around. But pandemics in particular have had a tremendous impact on the human story, accounting for an average of 400 million deaths over time. In December of 2019, the novel coronavirus that causes the COVID-19 disease took the world by storm, infecting over 50 million people worldwide and killing more than 1.3 million in less than a year's time. Yet, the COVID-19 pandemic isn't the deadliest of our generation. That title, unfortunately, belongs to HIV and AIDS. In the nearly 40 years since its identification, the HIV and AIDS pandemic has claimed 40 million lives, with another 40 million people currently living with HIV worldwide. Treatment and prevention have been the priorities in our pursuit for a world without HIV, and that would be enough to defeat most diseases, but HIV isn't most diseases. It's a pandemic that has overwhelmingly been exacerbated by discrimination, disparity, and stigmatization, where justice and equity and the defense of human rights must accompany science to truly achieve a world without stigma. We know from research that medical care accounts for only an estimated 10 to 20% of the modifiable contributors to healthy outcomes for a population. The other 80% happens within the framework of what we in public health call the social determinants of health, which are the structural determinants in which people are born, grow, live, work, worship, and age. It includes one's neighborhood and built environment, their economic stability. The social determinants of health includes one's education or access to education, their social and community context, and of course, their health and access to health outcomes. Because 80% of what happens with one's health happens within this framework of the social determinants of health, that's an opportunity for us. That means that civil society members can impact pandemics like HIV and AIDS just as much as doctors or scientists or epidemiologists, if not more. We just need to possess a passion for treating people and not just disease. Communities who can address the bar before the bars that prevent people from accessing HIV care. Structural barriers like racism and poverty and homophobia and shame, and yes, stigma. And I believe the faith community remains well positioned to address these social ills that continue to manifest as sickness in the most vulnerable populations. For many, faith traverses everything we do, and in many regards informs other aspects of our lives, including our health. The Pew Research estimates that 84% of the world's population identifies with the faith community. The World Health Organization estimates that 40% of sub-Saharan Africa's HIV and AIDS treatment and care are provided by Christian hospitals and health centers. More specifically, 60% of HIV and AIDS services are delivered by faith-based organizations in some areas of the world. And so as you can see, there is a tremendous, not only presence of people of faith, but presence of faith communities in the delivery of social and healthcare services. America also has a long history of health, human, and social service delivery by faith-based organizations. In the United States, these organizations have been providing essential services such as child welfare and child care, housing, transportation, counseling, and medical care since the founding of the nation. And their work continues. In conducting this work, faith-based organizations have filled or reduced existing holes in federal, state, and local government's safety net of service programs. Organizations like the Salvation Army USA, who's been well known for its multitude of community services, rehabilitation programs, and family services that provide a range of services that include emergency lodging, financial assistance, daycare services, substance abuse services, mental health care, respite care, and helping locate missing persons. Likewise, the Catholic Charities USA has provided social safety net services through its community educational programs and has provided educational support for parish-based services that has raised HIV and AIDS awareness. In 2002, its agencies provided help and created hope for more than 7 million people. In addition, the Jewish Board of Family and Children's Services of New York has treated social problems for more than 113 years. It established the first mental health program of permanency planning for the children of parents living with HIV and AIDS as is needed, based on Dr. Rana's initial remarks. Likewise, the Islamic Society of Northern America has provided a range of services to achieve its vision of contributing to the betterment of society at large. In addition to the Islamic Relief USA, which is a component of a much larger infrastructure that has made significant investments in ending the HIV and AIDS epidemic around the world. And finally, the Balm and Gilead Incorporated, which was founded by Dr. Pernessa Seal, who is pictured here, who established the Black Church Week of Prayer for the Healing of AIDS, the nation's first national mobilization campaign to specifically focus on HIV and AIDS that would eventually grow to become the National Week of Prayer for the Healing of AIDS that takes place in the first week of March of every year. So the foundation has been laid. We have the blueprint for what an effective faith response to HIV should be. We just have to continue to execute it in ways that are inclusive and affirming to all and alienating to none, regardless of race or class or gender or age or sexuality and ability. An HIV positive faith response must integrate prevention into faith messaging that promotes informed participation in biomedical interventions and reimagines what it means to be healed or cured from an incurable disease in the context of sacred texts. Finally, an HIV positive response must commit to eliminate all forms of stigma and discrimination that disproportionately impacts people who are marginalized and denies them access to life-saving information. In fact, just as decades of HIV research has prepared the scientific community to respond quickly to the COVID-19 pandemic, these same principles can help inform faith communities' response to the novel coronavirus. It's really all about creating access to life-saving education so the people who would benefit from it most can make conscious decisions about their health. This has been the motivation for the creation of the COVID-19 Prevention Network Faith Initiative, inspired by years of faith community engagement by its sister network, the HIV Vaccine Trials Network, or the HVTN. In response to the unprecedented COVID-19 global pandemic, the COVID-19 Prevention Network was formed by the National Institute of Allergy and Infectious Diseases at the U.S. National Institutes of Health. It brings together the infectious disease expertise of research networks and global partners to prevent COVID-19 disease by rapidly and thoroughly evaluating United States government-sponsored COVID-19 vaccines and antibodies. As you know, COVID-19 is impacting entire communities with a disproportionate effect on communities of color. These communities include Black, Latinx, and Native peoples of faith. So my colleagues and I, including Khadijah, who you'll hear from next, have been recruited as co-VPN ambassadors to connect with these faith communities of color in an effort to share the most current and factual information regarding COVID-19 and vaccines and antibodies being developed for its prevention. Our work includes the establishment and maintenance of a faith-based advisory council, the implementation of a national faith-focused COVID and COVID-PN education program, where educators will represent diverse faith, racial, and ethnic identities, also integrating anti-racist, anti-xenophobic, anti-homophobic, anti-stigma, and good participatory practice principles. Our faith ambassadors are distributed across the United States. All of us are equipped to speak to the intersections between faith and science, and hope to establish significant networks of faith leaders who are then able to conduct COVID and COVID-PN educational activities as we continue to traverse these very uncertain times. Likewise, we want to be able to engage clergy consultants and in partnership with them, develop and disseminate culturally specific COVID-19 educational materials that include common values found in sacred texts of various religions. The focus is to interact with communities of believers as a representation of faiths as avenues for conscious raising and information dissemination. God willing, we'll eventually know enough science to end both the HIV and COVID-19 pandemics as public health crises. What we'll continue to need are faithful communities to treat people and not just disease. And I hope today's program and what we hear for the days to come can help us move closer to that mandate. Right. At this time, I'm going to turn the floor over to my sister and colleague, Khadijah Abdullah, who will tell us more about her work around HIV and AIDS and how it has translated into very important COVID-19 work in her faith communities and from faith communities around the world. Khadijah, you have the floor.
Thank you so much, Dr. Burley. I'm going to go ahead and share my screen. So we can do that, and we'll go ahead and jump right into this presentation. Ignore all the stuff in my background. I need to organize it. Okay. Actually, I'm gonna close out for a minute. Let me start from the beginning. Okay, now we're ready. So my name is Khadijah, and as I mentioned earlier, I am the founder of Rahma, which means mercy in Arabic, and it's also an acronym for Reaching All HIV Positive Muslims in America. And today I'm gonna talk a little about Rahma and our work in COVID-19, and specifically the Black Muslim community, because I'm African American, and it's the community I most identify with and I'm doing work in. So let's jump right in. So Rahma's mission is to address HIV and AIDS, female genital mutilation / cutting, sexual health, and gender-based violence in faith communities through education, advocacy, and empowerment. And we keep Rahma, our mercy, in the forefront as we do our work. And it kind of leads the way in being compassionate and kind to others as we try to do this very, very important work. Our vision is we envision a world where marginalized and vulnerable populations feel safe within their own communities, regardless of their sexual orientation, gender identity, HIV status, faith, or lived experiences. And most recently, we partnered with the George Washington University, thanks to Dr. Radha actually for doing the introduction. We partnered with them and we created a toolkit for survivors of FGMC and also healthcare providers who provide care to them so we can provide culturally competent care to survivors. So you can find that at fgmtoolkit.gw.edu if you want to review the toolkit and learn more. Again, it's fgmtoolkit.gw.edu. For Rahma itself, we've been around since 2012, but really started getting into the work around 2015. I started Rahma because when I was in college, I met a Muslim man living with AIDS, and he shared, I was working in a hospital studying to be a nurse, and I was his aide. And when I was caring for him, he shared that he didn't feel welcome in his own Muslim community, and he felt stigmatized. And it kind of opened my eyes, because growing up, we very rarely talked about sexual health, forget HIV or AIDS. So it kind of pushed me to go to my college campus and organize HIV and AIDS Awareness Week. And then my friend, who was 19 years old, became positive as well. So again, it had an impact on me. And I started doing some research, trying to find there any other like faith-led, or especially in the Muslim community, doing HIV work. And I did find one, but unfortunately it had, closed down. So I started Rahma with the vision of just trying to do some educational efforts. And alhamdulillah, all praise to God, it has grown. We've done retreats, we've done workshops throughout masajids, our mosques throughout the US. We've been to actually out of the country. We did work with youth. And we expanded our mission to work in diverse faith communities, not only the Muslim community. And as a result, Rahma has helped found the National Faith HIV and AIDS Awareness Day. And the goal is to bring together faith communities across the US to address HIV and AIDS stigma in their community. In the first year in 2017, this picture you see here on the screen was at a rally we had in DC on Freedom Plaza. And we had a nice little turnout, but across the US, we had people virtually tuning in, doing their own events. And it was a really, really great experience. And we worked hard to get it to become federally recognized. And thankfully this year, we are now on the calendar as a federally recognized day. You can learn more at hiv.gov, or you can go to faithaidsday.com. So, when COVID hit, none of us was prepared for that or expected it. And of course, it has an impact on vulnerable populations, especially those with HIV or AIDS, because they already have, other things going on. And we have seen that a lot of resources that were focused on HIV have now shifted to focus on COVID resources. So people are losing access to care. They can't get to their doctor because they don't have transportation. It's so many different factors. So COVID has really affected people living with HIV. And we're really trying to support as much as we can. And so there's a stat that, Black folks are dying at 2.3 times the rate as their white counterparts. This is me here in a photo of my cousin. She passed away last month. And so I've lost an uncle to COVID this year in May, and that was her dad. And then she passed in October, not from COVID, but we feel from a broken heart because, she lost her dad. She's very, very close to him. And actually, we don't even know how she passed. She just passed away. We're still trying to figure that out. But I know like a lot of people in this world have lost people or know someone has lost someone due to COVID. So COVID is affecting our lives, impacting our lives. And again, Black folks are dying at 2.3 times the rate of white folks. We are disproportionately affected, and COVID is magnifying, racial inequalities in our communities. So it's something that we have to look at and something that we have to try to address and hopefully support and help our community keep us alive. So here's a little graph that shows, how much more we are unfortunately dying than Hispanic, American Indian, white, Asian, and other. And you can look at that more at covidtracking.com, but it's really, really showing how we are affected by COVID. And I would love for someone to put in the chat if a reason why they think, or a Q&A, why they think that our community, the Black community, is most affected by COVID. If you have an answer, feel free to put it in the Q&A and we'll check it in a minute or two. And, I put in that, I'll go into it since we have limited time. So we are affected by COVID. One thing could be discrimination, healthcare access. A lot of times we may be uninsured. I don't have access to the same care as others. So, that can be a hindrance. One of us are essential workers, so we don't have the luxury of staying at home and sheltering in place because you have to go to work and take care of others. We have income and wealth gaps. And then a lot of us live in places where a lot of other people live as well. So there might be chronic conditions, might have lost our jobs during COVID, or we have shared housing, which is, the more people you have in one space, the faster COVID can spread, or maybe we're even homeless. And again, we have conditions that are existing, like HIV, for example, or diabetes, or other things. And a lot of times, a lot of us might be incarcerated. So again, we're in a situation where there are a lot of people there, and it can be a breeding ground for COVID. And speaking of incarceration, I do a live every week at 9 p.m. Eastern. It's called Iman and COVID, Reflections from the Muslim Community. And last week we discussed racism, Islam, and COVID. This week we're discussing COVID, incarceration, and surviving marriage. And we're going to have these discussions around how COVID is impacting marriages, how COVID is impacting those who are incarcerated. So if you want to connect with me about that more, I have my contact information at the end of this presentation. You can contact me, but it's streamed on Facebook Live at I Am Khadijah, so you'll find it there, but it's every Wednesday at 9 p.m. Another thing we don't think about is that people in our community might be undocumented. So if you're undocumented, especially, in this time where this country is not really supportive of those who are not documented, not getting into all that, but just briefly saying that, you might be afraid to go and seek care if you're feeling sick or get a COVID test for the fear of being deported. So these are all different things that are affecting, the Black community and our population that we have to think about in regards to why we're affected. So I'm gonna check the chat real quick and see if anyone put any other responses here on why they think we are affected. So let's check here if it will show up. Maybe it won't come sharing my screen. It's not showing up for me.
Here, Khadijah, I can help you out.
Okay, thank you.
In the question and answer, there are a lot of amazing responses. Health access gaps, which you talked a little bit about. The lack of access to proper care, same thing. Underlying health conditions, which are a factor. Pre-existing conditions. So all these things are true. And the social determinants of health, and the bias in caregiving, which is something that we haven't necessarily touched on yet, but it's very, very true. The healthcare that we access, there's inherent and implicit bias in the system in and of itself,
Right.
that then makes us more vulnerable for disease. So absolutely correct in what we're hearing. Let's see, race and poverty, certainly. A lack of religious organizations engaging in health. So happy to have your participation in this forum so we can talk about ways in which health organizations are engaging in health and ways in which we can begin if you didn't have the blueprint before. So in the right place. Okay.
Yes, thank you so much, everyone, for sharing that. I really appreciate that. I love it when viewers are engaged and sharing their thoughts. These are all really, really great points. So thank you. And I'll be asking more questions again in a little bit. So stay tuned if you haven't joined or want to join later on in responding. So community response, we have to survive COVID, we kind of have to work together, right, to make that happen. So here are some questions to think about as we, go through listening to different webinars over the next few days or just living our daily lives. What do folks think is our next course of action to keep ourselves healthy? And if we can change one thing differently, change the way we're living, what would it be? And also think about people who are leading this country, or people who are your representatives, or your leaders, or your congressmen, or your councilmen. Think about them. Do you even know who they are? Do you know what they're doing to try to address this COVID pandemic? If you don't know, then it's probably a good opportunity for you to look into that, see what they're doing, see if they're making noise, but making changes, holding people accountable, or if they're leading by example. These are really good things to think about as we navigate this COVID pandemic and navigate keeping ourselves healthy and safe. And I know we just had, our elections, but it's always good to keep in mind, always continue to vote, think about who you're putting into the office, who's leading our country, because that can definitely save lives. Make phone calls, make sure your voice is being heard. A lot of times you let people speak for us, and then when they make decisions that aren't for us, it's good to be part of the discussion and be at the table. So think about these different things as well. If you have other things you think are important to add, definitely put in the Q&A, and I'm sure my dear brother, Dr. Burley, will keep an eye on the Q&A to see any comments. But these are the things I think about. As a community, we really, really need to come together to address COVID. I can't do it by myself. Dr. Rana can't do it on his own. Dr. Burley can't do it on his own. We have to do it together. Look at this little girl here. Like, we want to keep her alive, keep our families, like keep our loved ones alive. So I know we have, social distancing guidelines. We know that Thanksgiving is coming up and we miss our families, but we have to think about what can we do to keep ourselves safe and still, know that our family know that we miss them, that we love them. Like, what can we do? It's very important, because if not, we're going to be in this pandemic for a very, very long time. And, people are still going to contract COVID, and we're still going to see, as we know right now, the cases are rising every day. And some states are starting to shut down again. So just keep these things in mind. We have to come together as a community to really address this. You be anything in the question and answer?
Yeah, we have one new perspective in terms of environmental aspect, protecting neighborhoods from being dumping grounds, which is absolutely correct. It's not something that we always consider when we talk about health disparities, but we have data that absolutely suggests that redlining, the urbanization of certain communities over others, the industrialization of certain communities over others. We know that poor people and people of color disproportionately live in over-industrialized areas, disproportionately live near highways, factories, and other means, and these translate into poor health outcomes, like asthma, which becomes a pre-existing condition for illnesses like COVID-19. And so that's absolutely correct. Environmental activism for environmental racism is absolutely a way in which we have to begin to address some of these social determinants of health. Homeowner associations should get involved in building healthy communities programming. Absolutely.
Yep, that's true. I remember you had a discussion on another live that we did where someone asked, well, there's white folks that live in these areas too. How does it not affect them? Like, how is it different? Are they immune to becoming COVID positive? They might live in crowded areas. They might not have insurance. And what was your response? I loved your response. What was your response to that?
Yeah, my response was that poor white people still benefit from white privilege. And because they can access white privilege, they don't have to experience the implicit bias that people of color often experience in healthcare settings and otherwise. And so that becomes an advantage, just from the simple perspective of perception. And you or I, we go into a healthcare setting and people see our skin, people see our religious card, and that becomes factors for how they treat us within that system. They don't necessarily see our social or economic status when we, initially present. And so, poor white people who also live in these communities, who are exposed to these environmental issues, who might, live in food deserts or healthcare deserts, still benefit from white privilege. And because of that white privilege, they can then access certain things that people of color just can't, without having to deal with that stigma or bias. And so for me, those are the differences when we talk about, poor white people, poor people of color, and having the same situations and environment that creates illness. But it's really much deeper and kind of hinges along the lines of race, culture, and identity.
Yes. Thank you for sharing that. I definitely did put that perspective in there because someone might be thinking it or wondering it. So I wanted just to make sure that we just added that there. Okay, so here's some other ideas as well. Thank you again for sharing your thoughts in the Q&A. I can't see it, so I'm sorry if you missed anyone, but thank you for sharing that. So other things are educational activities. So as far as the COVID prevention network that Dr. Burley and I are a part of, we do educate our community. So we do lives like this, we do virtual events. Sometimes depending on how many people are there, if we're spread out, we might do it in person. of course, wearing our mask and distancing properly, so on and so forth. But education is key. A lot of us don't even know what's going on in the world. We don't have access to the internet, depending on where we are, what we're doing, or we don't even have time. Like, we're figuring out how to survive. We're working double, triple shifts. We're taking care of our children. So we don't even know, might not even know that the COVID cases are rising, or that someone might be positive next door to us. We don't even know that. So it's important that we are doing these activities, especially talking about prevention, even what's going on with the clinical trials and talking about that as well. These are important things to discuss with our community and talk to our seniors, especially those who are isolated, and providing information to them. And, you can send out resources through your mailing list. You can hold online webinars. You can create a little toolkit. And based on your faith, you can inspire it by faith. A lot of people in this country are, a part of a faith tradition, and they look to that faith for support and inspiration, especially during times like this. So adding that faith component to your resources is very, very helpful, hopefully, to your community, so they have that connection. And then there's also grants out there that you can possibly look for, for your faith community, whether it's your mosque or your church or, your temple, and see you can provide support to those in need in your community. People, they have lost their jobs. They might not be able to get food. Some kids don't only eat at school, and now that schools are closed in some places, might not have meals at home. Or, some people might have money for gas, or so on and so forth. So it's good to be aware of what's going on with your community and see how you can support them. If you don't have money, see if you're able to apply for grants. And again, just follow the CDC guidelines, social distance, wear your mask, even if you feel completely fine, even if you don't think COVID is real, the numbers in science, say otherwise. So it's really important to still try to protect the community, especially those who are most vulnerable, even if you feel completely fine yourself. So again, my faith tradition is Islam, but this can be applicable to people of all faiths, even those who aren't part of a faith, are just thinking about spirituality in general. How can faith or spirituality get us through? This is also some questions I'm asking you, those who are, viewing this live or the Zoom. And again, feel free to put your perspectives and your comments in the Q&A, and hopefully, again, I'll allow Dr. Burley to take a peek at it. But how can faith get us through? What can faith do? How can it keep us, thriving during this very difficult time? And what can our faith leaders do? And if they're not doing anything, what should they be doing? Or are they doing enough? Or are they simply human and support too? Think about these aspects of it. And then again, I mentioned grants earlier, but what are some other ways we can find COVID relief and other resources to support our communities? And what's missing? I know a lot of us are doing virtual worship. So how can we put together the missing pieces? What is missing from our community? What is our community not doing to prevent COVID? Is your faith community even talking about it? Are they providing you with information? Are you able to reach out to your faith leaders and ask questions? Have they brought in experts to talk about different topics they can't cover? What is your faith community doing to support you during this time in your community during COVID? So I just wait a minute or two to see if anyone has any responses. I'll go on to the next slide. UBs, anything there? Or Dr. Burley, keep professional.
No, not yet, but I also want to note that during the question and answer section, after Khadijah concludes her presentation, we will allow people to raise their hands, and then we can unmute you if you actually want to speak to what you've heard. And so if there are questions that you have that are burning and you haven't dropped them in the chat or the question and answer section, you can save them for the last 30 minutes of our discussion, and we will open up the floor so that we can hear from you.
I look forward to that. So Dr. Burley went over this briefly in his presentation as well. And again, this initiative came together because our communities are affected the most: Black, Latino, Asian, Pacific Islander faith communities. We are affected the most by COVID, based on the things listed earlier in the presentation as well. So we're really trying to, and a lot of us from these communities are part of a faith tradition. We rely heavily on faith. So by having this faith initiative, we're bringing the faith aspect to have that connection, and also bring in actual science and information to help prevent COVID from spreading up throughout our community, supporting our community. So Rahma actually partnered with the ADAP Advocacy Association and created an infographic on how COVID-19 is impacting Muslims. You probably can't see this very, very well, which is completely fine. You can email me and I can send it to you, or I can go on ADAP site, or I can go on our Facebook and see it there as well. But it shows that it's about 3.4 million Muslims that reside here in the US, according to the Pew Research Center. And we're not quite sure how many of us are living with HIV. We don't have the research or the data. And that's actually something I'm working on. So anyone out there that does grants or research, interested in, collaborating on this, let me know, because I want to really get data and numbers to show. Like, we do workshops, people always ask us, how many people are living with HIV? What are your numbers? And to us, if one is positive, that should be enough, right? But obviously people want to see data and research. So that's something we're working on in that regards, but looking at different things. Like, for example, you see healthcare and societal barriers. The Muslim Wellness Foundation, they're a really amazing nonprofit. They actually started the National Black Muslim COVID Coalition as well. And they did some research on how COVID is affecting the Muslim population. So if you look here, the numbers are kind of really tiny, but it shows compared to our Christian peers, the numbers. And our numbers are a little bit higher in regards to like less likely to have full-time employment, be laid off because of COVID. Well, actually Christian peers are higher in that regards, but it shows back and forth. Like the green is for Christians and the orange is, the green's for Muslims and the orange is for the Christian community. So it kind of shows, the different numbers and how we compare and contrast. Likely to work from home, likely to have to go without, likely to seek therapy or never been in therapy. And speaking of therapy, it's okay to not be okay. If you feel like you need to talk to someone or you need to seek out a mental health professional, go ahead and do that. And I know some people don't have insurance. There are some resources out there that can help you connect you with a mental health professional with low cost or free of charge, depending on what's going on. So definitely look into that as well. And then this infographic shows hate crimes, based the sources from CARE, Council of American Islamic Relations, and it shows that Muslim survivors of hate crimes often develop anxiety, depression, and PTSD. And they're about in just 2014 to 2019, there are over 1,000 hate crimes against the Muslim population. So, COVID can increase anxiety, it can increase depression, especially if we're isolated. So these are some factors we're looking at. And this was a 2-part infographic. I had to kind of like break it in half to fit on this slide. But the second slide actually shows, in US counties that have some of the largest Muslim populations, and then it shows how the COVID prevalence in those communities as well. And it shows how many people have passed away, how many cases there are. So it's focusing on Illinois, Cook County, Wayne County, Michigan, right here where I live in Fairfax County, Virginia, Dallas County, Texas, Passaic County, New Jersey, and it shows the number of cases and the number of deaths. So we can, kind of think about, and you probably think there are a lot of Muslims as part of these numbers as well. So again, this is a quick infographic that we made. And I can definitely, if you want to email me later on for it, please contact me and I can send it to you as well. Or you can go to the website or to our Facebook and check it out. And if you have any questions about it, we can talk about it after the presentation. So that's basically it in regards to just a brief snapshot of some things we're thinking about and doing. So as far as the COVID network with UB, Dr. Burley, and other faith leaders, we also working with faith leaders in our community. So right now, I'm working with 6 imams across the country, as far as Chicago, California, Texas, New York, New Jersey, Virginia. And we're working together to educate our community on COVID-19 and bringing in, we're able to cater our discussion based on what your community is asking about, our needs. And we have, a wealth of resources. We have experts in the field. So if you want us to come to your community and talk about different things in regards to COVID, whether it's vaccines, clinical trials, prevention, what kind of population, affects senior citizens, youth, like all these different things, let us know and we can come and present to your community. We're focusing mostly on African Americans, Latino, Asian Pacific Islander communities. Those are the ones that are most, disproportionately affected. So if you need resources, you want us to do a presentation, please let us know. Dr. Burley and I are available, or some of our other faith ambassadors, or even some of the scientists that are doing the clinical trials. So just let us know. And with that, I am all done with my presentation.
All right, thank you for that, Khadijah, and thank you to all of the participants who were so engaged during both of our presentations. In a second, we want to give you an opportunity to hear from you more because we want this to be interactive and conversational. But before we do so, the sub-theme, Khadijah, of this morning's webinar is Healing the Divide. Healing the Divide, HIV and Faith and Resilience and Renewal, Healing the Divide. So I ask you the question, what is the divide for you in your context and the work that you've been doing, and how is it that we go about healing that divide?
I think that people have different perspectives on how COVID is affecting their community or affecting them. And unfortunately, with that kind of mindset, it's increasing COVID incident rates and its prevalence, and is causing discord, I feel, in communities. I feel like we should have a uniform front. I mean, it might be hard to do that, but I think we all should have a basic uniform front. Like, we know COVID is real. Science tells us that over and over again. We see the cases rising. We see people are passing away. Like, that's science, it's facts. It's not like some, conspiracy theory. And then we know that people turn to their faith leaders for support, right? So they look to you as their role model. So faith leaders, they do have a burden, if you think about it, but they sign up for this kind of a position as well. Their burden is to lead, right? And, if they need support, they can also get support also. You don't have to just carry this burden and then, not support and take care of your own mental health or self-care. But people look to them as role models. So if you are a faith leader and you're not following the CDC guidelines, maybe you're holding events where you're not social distancing, and then people might become sick. My question is, how can you hold that on your conscience, right? People are passing away. How do you live with that? We have to work together. We have to unite. We have to heal this divide of having our own thoughts about this and that, because again, it's all in numbers, it's all in the science, and we need to keep our community safe. So I think to push aside any pride or whatever it is that's preventing us from addressing this. And if you don't know certain things, bring in experts, bring in people that do know, that can talk to your community about it, that can address different things for you, and that can heal. I know a lot of people have they're concerned about vaccines, and I understand it, rightfully so. Through the history of our communities with, Tuskegee, all these different things, I understand people's hesitation. But I think education is also very, very important, and see how far science has come and how far we have advanced, and bringing someone who can talk to people about vaccines, answer their questions for them, address their concerns about it, and help this allows them to make their own informed decisions. Don't make the decision for the community for you. Like, don't make the community decision for yourself for them. Let them do it themselves. Let them learn. Let them hear the information. Let them understand the information, and then they can decide what they want to do next. So I just think in order for us to heal and move forward, we have to understand that COVID is very, very real, and we have to take steps to make sure that our community understands this, and then look for resources to support them if we don't have those resources.
Yeah, absolutely.
I mean, same question to you. What do you think? How from your perspective, how can we heal the divide?
Yeah, much of the same for what you mentioned. For me, the divide is between faith and science, which you talked a little bit about. And one of the reasons why I do this work in the way in which I do it is to try and heal that divide. I am equal parts scientist as I am faith leader or person of faith. And I don't want to have to compromise either one of those things to do what I consider to be very important work. And so I think that we have to, the divide is often between faith and science. And even, in the last, so many years, politics and science. And one of the ways that we bridge that gap, heal that divide, is by having these kinds of honest and open conversations that share resources, but that also glean wisdom from others as to what they need and what's working in their communities. But yeah, so the divide between faith and science, for me, there isn't a divide at all. Faith and science are very much one and the same, in that both are grounded in the sanctity of life, right? The preservation of life and life abundant. Any faith tradition, any background, that's going to be a core theme, life and life abundantly. Likewise, scientific research, scientific medical research has been wholly based on extending life, the sanctity of life, the preservation of life, the quality of life, and life abundantly. And so for me, faith and science are very much so one and the same in terms of the end goal. And that's what helps me to be able to continue to do this work faithfully, knowing that my faith doesn't have to compromise my science, and my science doesn't have to compromise my faith, because the end goal is the same, to increase life, to preserve life. I think the other divide that has become more apparent now than it has ever been is the divide that's present in our country, right? As a civil society, whether it's politically or socioeconomically, or even spiritually, in terms of what we deem acceptable belief systems and unacceptable belief systems, and some healing has to take place quickly, and I think that it's going to begin. And I think we, have a long way to go, but COVID and HIV notwithstanding, we have other illnesses that have and continue to impact our country. And if we don't deal with that divide of otherness that pervades our society, the divide of not necessarily operating in the best interest of our neighbors, but just the best interest of ourselves, we have to begin to heal those divides before we can even talk about, COVID-19 or HIV and AIDS. And so I think we're headed there in that direction. Like I say, these types of honest forums and conversations are helpful to be able to, really tease out those things that keep us apart, those things that segregate us, the stigma and discrimination that exists in all that we do. And we have to name them first before we can deal with them. And so I'm grateful for this opportunity to be able to do so. And I want to now open the floor to hear from some of the many participants about what they've heard, what they didn't hear, and some of the things that we should be doing on our end to heal the divide, if you will. But before I do so, I want to welcome Dr. Radha back into the conversation to offer his comments.
But before we do that, I wanted to say one more thing. In the Muslim tradition, our Prophet Muhammad, peace and blessings of Allah be upon him, said, tie your camel and then do what you have to do. Like, I mean, I'm obviously paraphrasing it. Yeah. So basically, first tie your camel and then trust in Allah. So tie your camel, which means learn about COVID, learn about the prevention, and implement those prevention methods, and then trust in God. Don't necessarily trust in God and think everything's gonna happen. You have to actually do the work. So I wanted to just bring in that quick hadith that he mentioned, one of his sayings, because it's very important to keep that in our minds. And we're saying, well, God will protect me. Okay, yes, but he's giving you tools to protect yourself. But kind of utilize those tools.
That was very wonderful, Khadijah and Ulysses. One of the things that I struggle with in my discussion with many imams and church leaders, I think this is probably more prevalent in Jewish community, is the issue of equating illness with punishment and personal responsibility, and where is the divide? And it is a very, I think if we focus on, I think ultimately when we look at our scripture, it's very clear that illness or any other disability or trial, if you may, is just a trial. The whole life is a trial, and some of the best people, chosen people, the prophets, suffered the most punishment, if you may, or most trials. So you cannot equate condition and illness or with personal responsibility. They did it to themselves. And that's the biggest thing with HIV, people saying, oh, they did this. So separating the two is one of the most difficult thing. And I think we need to hammer on that issue over and over. But I think it'd be so important to get the audience involved on this issue, how often they hear this issue. Thank you.
Thank you, Dr. Ronald. So if there's anyone who'd like to speak at this time, who's tuned in, there's a function that allows you to raise your hand.
We have a few questions here in Q&A. Oh, Kamal. Hey, so thank you, presenters. Alaikum, Kamal. Someone said, how are racial inequity and civil unrest affecting COVID-19 and HIV access to care or prevention efforts? You want to take that, Dr. Burley?
Sure. Let's see. So, I think we spoke to it somewhat in terms of the inherent bias that exists within the healthcare system. Khadijah, you talked a bit about, the legacies of the Tuskegee study for untreated syphilis in the African-American male. And John, I see you have your hand up, and so we'll get to you next. And that bias is real, right? And it has, the system has history of being untrustworthy. And because of that untrustworthiness, it has resulted in a legacy of medical mistrust from the communities that, when we talk about HIV and AIDS and COVID, need access to healthcare the most, right? And so it's kind of how, to make another analogy, chattel slavery hasn't been the law of the land for a while now, but you can make an argument that the legacy of slavery has been passed on from generation to generation that has then impacted those who were enslaved and descendants of those who were enslaved mentally. And I think the same is true for the legacy of medical untrustworthiness that disproportionately impacted people of color, namely Black people, and how even, some of those atrocities are no longer exist because of infrastructure that has been put in place to make sure that they don't. The legacy of those atrocities still impact us. And, we had questions about internalized stigma. And so these become internalized stigmas around science. You talked about vaccines, which, we're all going to have to come to terms with, as we think about a way out of the current pandemic, COVID-19, but even as we think about ending the HIV and AIDS pandemic as a public health crisis in the near future, biomedicine, right? So we have to find ways to unwrap the internalized stigma around these things as a result of very unfortunate history that is real and valid, but that continues to keep us oppressed and denies us access to those things that we end up needing more than everyone else because of disparities and social determinants of health. And so, that's just one of the ways in which racial inequality has, manifested to continue to make us sick. And there are others. And so John had his hand up, and I'm going to, and then Lisa.
John Kahura.
And, yeah. So let me find John in the participants list.
He's up there.
Okay. All right. Let's unmute John. Do we? Okay. I unmute. All right, John, you should be, let's see, unmute John. Well, I keep hitting unmute, but if it's not happening for me, John, are you able to speak?
Yes, unmute himself, looks like.
There we go. Okay, John, you have the floor. You're unmuted.
Okay, I want to know about the issue of stigma in mental health. Here in Africa, we are having a lot of problems because the people are affected. And actually, it's a high time as the Ghost Stigma people, wherever you are, you think about Africa. We are struggling, and actually we need at least help to sensitize people or to tell them, to inform the people about stigma in issue concerning mental health. Otherwise, I'm glad at least watch you at this time. Thank you.
Thank you, John.
Thank you. Thank you.
You back. And so I'm not a mental health professional, but I very much so acknowledge that stigma regarding mental health is tantamount to that regarding HIV and AIDS, right? And oftentimes they intersect. As a Black American male, I can tell you that there has been tremendous stigma around mental health in my community, as it's often viewed as a weakness or as a disability or as something that makes us less than. And so we've been taught to bury it, to internalize again, any thoughts of weakness or emotion or otherwise that has then manifested negatively into other poor health outcomes. And so for me, it's been very important to openly talk about not only mental health challenges, whether it be depression or anxiety or more severe diagnoses, but to also endorse and openly speak about the solutions for those, and therapy and counseling and guided meditation and even spirituality and rituals. One of the aspects of my work has been to engage faith leaders around these issues of dealing with not only their own mental health and preserving and caring for their own mental health, but also resourcing the mental health needs of the people who they serve. And a part of that resourcing is being willing to admit that you don't have the tools that you need to help those people. And so a lot of people, especially communities of faith, say, oh, I'll go talk to my faith leader about my mental health issues instead of speaking to a professional about my mental health issues, because then there's less stigma associated with speaking to your faith leader about, intimate things. But the truth is, many of our faith leaders aren't equipped to deal with clinical mental health issues. And so a part of the mandate for us as faith leaders is to say, hey, I don't have the tools to offer you a solution for what you're going through, but I know where we can resource, where we can access those resources, and I'll hold your hand and I'll go with you to be a part of accessing those resources. So we have to, again, normalize conversations about what happens above the neck, I like to say. Normalize conversations about what happens below the waist, right? We tend, especially as people of faith, we maintain our health between, you know, our neck and our waist. But, you know, we have mental health issues, we have sexual and reproductive health that's very real. And as communities of faith, if we want to continue to minister to the whole person and to continue to, you know, advocate for a complete wellness, the kinds of wellness that we talk about in our sacred text, then we have to address mental health. We have to stress sexual and reproductive health as a component and functions of kind of our whole body and our whole wellness. And so absolutely, mental health is a part of the conversation when we talk about stigma and internalized stigma, and we as faith communities have to do better to address that particular stigma. Khadijah, do you have something to add before I open it up to Lisa Best, who has her hand up?
Yeah, and I think that people think that faith leaders are all in one, like they can handle every situation. They know to be the marriage counselor, the mental health counselor, the faith leader, like it's so many different things. And that's a lot of pressure to put on one person because they can't be everything. But a lot of times there are communities that don't have the resources to bring in other professionals to support the community. So definitely, I think that it's important that faith communities do have a, mental health professionals there. And if they can't, provide links to that, if they can't do it themselves. Like for example, in the Muslim community, I was just doing some workshops the other day with a Islamic focus center called Khalil Center, and they're national and also in Canada. So KhalilCenter.org, and they focus on mental health in the Muslim, from a faith perspective of Islam. And they have counselors across that are licensed doctors, are psychologists, are psychiatrists, and they provide support to you from the Islamic perspective, but also actually provide mental health support as well. So being able to know those resources is helpful. So if your faith leader has like a list, if they can't do it themselves, like bring in a list of people who can help you, whether you have insurance or not, and that's also good to have. I think it's very, very important because all of us are being affected. Like I wrote a blog post about mental health and COVID because it's just that serious, like it's very serious. And you could be the happiest person in the world, but COVID can still very much so affect you. So this definitely knowing where you can go to for support is very, very important. So I just wanted to add that.
Very good. And I want to be sure that those of you who are putting questions in the question and answer, I see them. And we'll absolutely get to them. Lisa, you are off mute and you have the floor.
Blessings to all of you, the panelists. And my question comment kind of was responded to in the question and answer by you, Mr. Bailey, and the doctor. The response to COVID in houses of worship is really universal. No matter what faith house you belong to, there are a lot of prayers, there's a lot of support, there's resources. In my church, we have a wellness person that does education every week, but we don't have that same reach with HIV. And the connection, I think, and the distinction is around sex. And I think that that's the part of the conversation that gets very uncomfortable and difficult to have in houses of worship. So if this is a place where we are healing, how do we begin to have this needed conversation in a safe and supportive way? Thank you.
Thank you for your question. Khadijah, I'm going to let you take that first.
I'm sorry, I thought she said Dr. Burley. So I know with my work with Rahma, sex definitely is a topic that makes like people want to shy away from like working in the Muslim community in mosques. But we have to keep in mind that we all got here through sex, or at least most of us did. I mean, there's other ways that people might go through IVF, so on and so forth. But for most of us, we got here through sex. And it's important that we keep that in mind and that we talk about it. It's a natural thing, not to be ashamed of or afraid to discuss. So what we've done is that we've kind of decided what community we're working with and cater to that community, because every community is different and we can't use the same kind of uniform response to everybody. So let's say it was like a more conservative community, then sometimes we just have intimate conversations like this of the same sex. Like we'll sit with someone like all women, for example, because they're more comfortable talking about it that way, or all men. And for those who might be more progressive, you might have a combined discussion. So it all depends on what the community is and what their comfortability level is. But it's important to talk about it, because in regards to HIV and AIDS, you know, you can become positive through sex. You have to talk about that in that dimension. So, and then we also bring in the faith aspect about sex and, you know, how we created. I mean, it's all basic knowledge. As I mentioned earlier, when I started Rahma and I met the man living with AIDS, he told me that, you know, he felt stigmatized, and it made me realize that we didn't even talk about sex growing up. Like I was removed from sex ed class in 8th grade. So like, it tells you a lot of the kids learn about sex on their own, and then it kind of exposes them to risky behaviors. So they're gonna learn about it one way or the other. So why don't learn about it from their community? So I think that communities have to look at ways they can explore this topic with their youth in their community and talk about it. Some people don't learn about sex until they get married. And then by that time, you kind of should know something you learn about on your wedding night or whatever. Or some people have sex outside of marriage and learn about it then. So you have to be able to cater to all communities and all voices on populations and really understand. And, you know, it could get intricate, but I think the first step is having a discussion about it and understanding your community, understanding what the accountability level is, and kind of incorporating it that way. So that's my quick response, because I don't think I heard the last half of the questions, to be honest, because those like to turn to Dr. Burley. But Dr. B, you want to add anything else to that? You know?
Yeah, no, I think your response was spot on. And there's actually another question in the Q&A box around, you know, how do we get faith communities, churches on board to realize that sex is natural and none of us would be here without it. So we have to address it. We have to talk about it. And so I'll try to answer two questions with one answer in my comments. You know, Lisa, you're absolutely right. One of the difficulties of this work has been addressing the elephant in the room, right? As it relates to HIV and AIDS, and that elephant is sex and sexuality. I have had instances where I have been given very strict requirements for talking about the work that I do in faith communities. You know, some people might say, oh, sure, you can come and you can talk about HIV, but don't talk about sex or don't talk about sexuality. And then in those moments I say, well, then I can't, you know, authentically talk about the HIV and AIDS epidemic if I can't speak about these aspects of the epidemic. You know, the truth is, if we cured HIV and AIDS tomorrow, we would still have issues around conversations of sex and sexuality in our faith communities. The benefit of the HIV and AIDS epidemic, at least for me, if I can call it that, is that it has forced us to have these difficult conversations where we otherwise have been able to avoid them as faith communities for centuries. And so if, again, the foundation of our faith is life and life abundantly, to preserve life, then by mandate, we are charged to address issues of HIV and AIDS, where 40 million people, 40 million lives have been claimed, another 40 million currently living with HIV. It would be a dereliction of our faith duty to ignore the HIV and AIDS epidemic. And so because we, by faith, have had to address it, we also then have to have serious and hard conversations about the interpretation of sex and sexuality in the context of our sacred scriptures. And it hasn't been easy work, but it has been progressive work in that there are faith leaders out there who are willing to ask questions, who are willing to reimagine sacred texts, to theologize, you know, issues around sex and sexuality in a way that don't harm people, but that affirm people and that love people. And we've been blessed to work with those faith leaders in our work. And the hope is that, you know, one by one, we can continue to kind of chip away, bite away at the elephant in the room around these issues that will really empower, you know, faith communities in a new way to be able to, you know, positively be a part of the response to HIV and AIDS. But it's going to take hard work. You know, one of the other questions in the comment box is, you know, a lot of the stigmatization has come from faith leaders in terms of their interpretation of various scriptures, and how then can we expect people to seek faith for healing when it's been the faith that has done a lot of the harm? And I absolutely agree with that and affirm that. And I can say that one of the ways in which I know, you know, we are working to help faith leaders to theologize, you know, HIV and AIDS in a new way, in a way that's affirming and loving and inclusive, is that HIV and AIDS training and education becomes a part of their theological training and education. So if you can give people resources, you know, before they are fully indoctrinated in a particular ideology, then perhaps you can help them craft and grow in their own thinking around these contemporary issues as it relates to, you know, 2,000+ year old text. And so engaging, you know, people in seminaries in their training and theological schools and otherwise, where HIV and AIDS is a part of that learning, so that when they are sent out into the communities, they're equipped with information to be able to, in a better way, engage these difficult issues in a more, you know, progressive and affirming way. And so there are a lot of different programs that are taking place to, again, engage, you know, these up and coming faith leaders as they emerge early in their education, so that, you know, this is something that we hear from, you know, temples and churches and and synagogues and mosques, you know, right away, and not something that, you know, we have to spend another 10 to 20 years to come around to, because we just don't have another 10 to 20 years in terms of life and the HIV and AIDS epidemic. And so much work to be done, but trust me, myself, Khadijah, Dr. Rana wouldn't continue to do this work in this way if we weren't seeing some level of progress. And I think this discussion today in and of itself is an indication of that progress. We've got about 3 minutes left until the end of our session. I want to acknowledge all of you who have engaged the question and answer section. I want to also apologize to those of you who had your hands raised and did not get an opportunity to speak. We are available via email to answer any burning questions or to give you access to some of the resources that we introduced during this time. No man has a monopoly on information. And so a part of this session, a part of our work with the co-VPN is to make that information accessible so people can make informed but also conscious decisions. And so I thank each and every one of you for your participation. No, I'm gonna bring you back in. I want to thank each and every one of you for your participation. And now I'm going to turn it over to my sister Khadijah for her closing remarks.
Yeah, I wanted to respond to the question about trauma and spiritual trauma, because that is something very real that we have seen with our work with Rahma and regards to HIV. And a lot of folks have left their faith because of the trauma they have experienced when it came to HIV. So what we've done is we talk to imams and we kind of talk about language. Language matters. Like the words you use can have a really serious impact on how people perceive it. If you're saying stigmatizing words, that push people away. If you're not inclusive, if you're not showing that there's a space for everyone in your place of worship, that turns people away. And if you don't know about HIV or how it affects, that's very important. So we do a retreat every year, and people come to the retreat and they feel like it's a space for them. But we want to kind of expand that space outside of the retreat. Like you mentioned, having trainings, education is very, very important. So I think we have a lot of work to do when it comes to faith. A lot of people have left their faith due to their sexual identity, gender identity, sexual orientation, or their HIV status. So we have a lot of work to do, but I think if we do, when people come together and, you know, are willing to be educated about it, we can do a lot more. So again, contact me, UB, we can help with that. I know the person who asked can help as well. I know they have experience in it. But I think it's very important that we continue this work because everyone should feel safe in their faith community. And then I want to thank everybody else as well who joined this, because we still have a pretty over 100 people on the call still. So that shows that people are still engaged and attentive. And that shows that it was a really, hopefully, good discussion. We all hopefully learn from each other. So thank you for attending, and please feel free to contact us if you want to do a workshop or do any trainings or anything. So thank you for your time.
Yeah, we invite you to engage the remainder of this Faith Day of the International Conference on Stigma. There will be a moderated panel discussion this afternoon at 1 p.m. Eastern about reaching vulnerable communities as it relates to HIV stigma and otherwise. And then finally, this afternoon at 3:30 p.m. Eastern, there'll be a discussion around the framework for dialogue between faith leaders and people living with HIV. And so if this conversation was food for your soul today, then you don't want to miss out on the following conversations that will happen throughout the rest of the day and through this week. And so thank you all again. Thank you to the International Conference on Stigma for your partnership. And we look forward to continuing this important work with all of you.
Bye.